Good afternoon to all of you. We thank God for this beautiful day. Today, we'd like to give special thanks to our Government of Nagaland Medical Department for initiating this program for us. This is one of the much needed programs that we have been expecting for quite some time. We as lawyers, we are independent by nature. And the government, we are not saying that the government has overlooked us in any manner, but health is one of the primary sectors that is important to all of us. We are human beings, we are prone to get sick. And today, this special program that has been initiated for us, we are truly grateful to the Department of Health and Family Welfare. We are also honored by the presence of His Lordship Justice Nelson Silo, Justice Pranjal Das, and they will also be sharing, Justice Nelson will be sharing a few thoughts with us. If His Lordship Justice Pranjal Das also would like to say something, that also will give him the opportunity to address us. And to start with the program, I will ask our President, Mr. Sidi Jamir, to give the introduction. It's going to be a short program. Sir.
Mr. Joshua, the chairperson of the program, Honorable Mr. Justice Nelson Sailo, Judge Gauhati High Court, Honorable Mr. Justice Pranjal Das, Judge Gauhati High Court, Dr. Kikamaran Longkamar, Joint CEO, NHPS, Mr. Achungba Mchen, Registrar of the Gauhati High Court, Kohima Bench, learned members of the bar, officials from the registry, media, ladies and gentlemen. At the outset, I would like to welcome each and every one of you to this program. In fact, for organizing this seminar, we have been discussing since last year that we should have a camp where medical personnel can be invited, and then whatever facilities the government is providing, we can also avail those facilities. But then we lack the support from the experts. Therefore, we sought the help of Mr. N. Mozoi, who has been coordinating with the medical department and also with the bar. And then, in fact, we wanted to organize this last year, but then due to one or the other reason, the seminar could not be held last year, and only this year we could manage to have this program in coordination with the registry of this Honorable High Court. Today is a rare occasion where lawyers and doctors are meeting. I think it's very rare to meet these two communities together, but we are very happy that today we are together. We have so many similarities and dissimilarities in our profession. A lawyer argues the cases in the court with best of his abilities, and after conclusion of the hearing, at times we lost a case in spite of our best effort. Similarly, the doctors, when they conduct the operation is successful, but at times patient dies also. So it's similar in our practice. Again, doctors wear white dresses, lawyers wear black dresses. That is one dissimilarity. But again, there are many similarities and as well. After arguing the case, the arguing counsel will ask his junior, his assisting junior, have I put everything to the court? He will say yes. Then the arguing counsel will be satisfied and conclude the case. A doctor, similarly, after the operation is conducted, the surgeon will ask to the assisting surgeon, have I taken out everything? Yes. Then operation will be completed. So in case of lawyers, we are putting it, whereas in case of doctors, they are taking it out. So the mission is accomplished. But then both lawyers and doctors, we render services to the society in different ways. And these are all for the services to the humanity, and all of us should have the responsibility in our respective level to render and to give best services to the society. That should be our objectives. Today, I would like to express my gratitude and thanks to Dr. Kika and his team that they have volunteered to come and then render services to the legal fraternity of the state and also to the registry. As we all know, the lawyers do not have any security. At times, I used to say that we are daily wagers. Of course, maybe in a different level, but then we do not have any security. For a government servant, they have so many securities, service securities, but for lawyers, there is no security, and there is no guarantee that lawyers will not feel sick, and we don't submit any application to feel sick also. So sickness may struck us at any time without any prior information. During such time, we need some sort of an insurance. So today, with keeping in mind and then with those objectives, we have organized this seminar. I hope this seminar will be very fruitful, and then I hope many of us will get registered, and then we can avail the facilities that is being provided by the government. That the scheme, Chief Minister's Health Insurance Scheme, under this we can get some medical facilities. Of course, that will be cashless, and then the manner of the scheme, all this will be explained by the experts who will be speaking after some time. So I wish this program will benefit the legal fraternity of the state, and I also look forward even to extend more help even in future. And I hope today the program will be successful, and I wish you all the best. With these few words, I conclude. Thank you.
Thanks to our president. He has introduced this program in its right perspective. Now we have short speeches. First, today's leader of the team that has come to introduce these facilities to us, Dr. Kikamer Longkumer, the Joint CEO of the Nagaland Health Protection Society.
Respected chairperson of today's program, Honorable Mr. Justice Silo, Judge Gauhati High Court, Honorable Justice Mr. Das, Judge Gauhati High Court, President High Court Bench Bar Association and esteemed members of the bar, registrar and officials of the registry Gauhati High Court, Kohima Bench, my dear friends and our media friends, we have been anticipating this partnership for a very long time since Mr. Mozoe approached us, and as our president has said, we are of different profession, but there are a lot of similarity, and I will add one more. As a professional, we don't have retirement. So once we are born into the profession, then till we die, we remain as a professional. Unless you want to, we want to voluntarily retire from the profession. So with that, I would like to just walk you through what is this public health insurance schemes that we have. And second part will be today also we will be, in addition to the enrollment, we will also have some health screening. For that also facility has been brought in. So second part I will dwell a little bit, maybe 1 or 2 minutes on that. So with the launching of the Prime Minister Arogya Yojana, Jan Arogya Yojana, we call it PMJY, or commonly it is also called Ayushman Bharat. So there's several names are been going around, but officially it is the Ayushman Bharat Prime Minister Jan Arogya Yojana. My pronunciation may not be very perfect, but that is in the year 2028, the central government has launched this scheme. And in the meantime, in our state also, we had one form or another, we were having some sort of a social security scheme like the BOCW, you must be aware, the building and other construction worker under the Labor Department. For the government servant, we had this medical reimbursement and etc., etc. And on the other side, when we look at the different groups, sections of the society, we have one section, the most required, but they were not covered, the pensioners. By being elderly, we all will be landing in that sooner or later, in that section of the society. But this elderly group, the pensioners, they were not covered at all in any of the social security services. So that was also one thing. And also there are some section of the society, like they were not covered under the PMJY, nor they were government employees, nor pensioners. So we call it them as a missing middle. So these people were also not covered. So the government, the state government decided to have its own insurance scheme in addition to the PMJY. So this scheme was, named as the Chief Minister Health Insurance Scheme, and it was launched in 2022. It has got two sub schemes. One is for the employees and pensioner, covering with an insurance coverage of 20 lakhs per family per annum, and another for Cmhis general, we call it for those missing middle. So when we look at the different section, then PMJY covers about 2.59 lakhs families in our state, and government employees and pensioner, we are covering about 97,125 households. Though we may have more government employees and pensioners, but in certain households there will be more than one government employees. So that is how we put a factor, and then we have fixed the number of families to 97,000. So that is one thing, and then the middle group is we are covering 20,000. So about 96% of our total household is covered in Nagaland. The total household is about 3.97 lakhs as per the census 2011. So here, the state employees and pensioners, we contribute 50% of our monthly medical allowance towards the payment of the implementation of the scheme. Now, when the contribution, when we assess, it comes to about 60 CR in a year, that contribution. 400, some are paying 400 per month, some are paying 300, depending on the category of the employees. So about 60 CR is collected. However, the premium, it is going up as we utilize the services, the premium goes up. So for example, PMJY, the 5 lakhs category, in the beginning it was about 400 something, 420, like that, the premium, discovered premium was that. Now today it is 1,477. Similarly, for the Cmhis EP for the 20 lakhs, initially it was about 1,500 or so. Today, now we have ours, the discovered premium is 9,670. That means the state government is contributing again over and above our collection. So when we look at the number of the amount collected, 60 lakhs, and the premium to be paid to the insurance company, that comes to about 94. That means about 30 to 34 CR is been contributed by the state government towards the employees and pensioner. Similarly, for the 5 lakhs category also, the state government is contributing about 40 CR for the PMJY, and another this things around 10 CR towards that Cmhis general category. So that much budgetary implication is there for implementation of this. We would like to expand further, considering the need of the people, but because of the budgetary constraint also, we are unable to expand the treatment of covering the entire range. However, so therefore, we are covering only the inpatients, that means the admitted patient, not the OPT, outpatient. Okay. So that is where we are at. Maybe in the future, government may come out covering the outpatient also. So that is where we are at. And then we have impaneled hospitals within the state as well as outside the state. So about 60, 70 hospitals are outside Nagaland, and especially we focus on those places where the patients or the people from Nagaland, whether it is the hospital is impaneled or not impaneled. So that provision is also given. Now, to impaneled hospitals outside Nagaland, what we have done is that this hospital should be NABH accredited. That means the Quality Council of India, they have this hospital accreditation scheme is there, standards is there, so they have to be impaneled. So by asking for this, making it mandatory, one thing is that there is an assured quality service to be provided. And humanly, it will not be possible also to crisscross the entire country for visiting those hospitals from Kanyakumari to Kashmir or from the Jamnagar to this side, from east to west, north to south. So that is how we have insisted upon the accreditation. So depending again on the accreditation, and then whether the hospital is a teaching hospital or in what type of level of or the criteria of the city as per the Niti Aayog classification of cities, we give them incentive. So because of this attractive package rate, many good hospitals have been onboarded into the scheme. This service, we have to, each and every individual should make the card, and then touch wood, whosoever is sick, to produce that one, the card to any of the impaneled hospital, and then the services will be provided cashless. There are also instances where we have received grievances that the hospitals are charging money in addition to what the scheme is providing. So we have also opened a toll-free number where 24/7 our toll-free helpline anybody can access and then address. Whenever those fraud, the so-called fraud, is been established, we penalize to the extent of suspension of impanelment. So such cross-checking measures have been put in so that there is seamless delivery of services to the needy people is put in place. Besides this, the details we'll be discussing in the second session after the break. So I will come to the second part. Now, I'm very grateful that one of our retired colleague, Dr. Hukha, has joined us, as well as Dr. Belva. She is the MO of the UPSC Shikazo, so they have come here to help us in any screening, whether you have diabetes or sugar, or even now the department is, as per the national policy for elimination of tuberculosis by 2030, the Honorable Prime Minister has launched this TB Mukh Bharat Abhiyan. So this elimination process is going on, the steps towards that, and therefore Dr. Bilva and her team has also brought their X-ray team, so anybody who is interested to have the X-ray done of their chest can be, that facility also can be availed in today's session. So with that short introduction, I would like to end my speech. Thank you very much.
Thank you, Dr. Kika, the Joint CEO of the Nagaland Health Protection Society. With that, I believe the members have more clarity as to what this program has been initiated for today for all of us. Now I would like to invite on stage the Honorable Mr. Justice Nelson Silo to share his few thoughts with us.
Thank you very much, Mr. Joshua Seki, Secretary of the High Court Bar Association. My brother Pranjal was here, but he's traveling, so he had to leave. So I just informed the gathering for that. Mr. C.T. Jamir, President, High Court Bar Association, Dr. Kikamaran Tlongkumar, Joint CEO, NHPS, then Mr. Imchan, Registrar, Kohima Bench. Of the dais, we have the members of the bar, OBs, be a part of this seminar to participate in the seminar, at least in the inauguration part. This is a very important thing, especially for the bar and of course for the members of the registry as well. Like the President had pointed out, members of the bar, of course, you'll be having difficulties because you're not a government servant per se. So, but this insurance scheme, the Chief Minister's insurance scheme, covers the public. So you're being covered by the insurance scheme as well. And it's a good thing that this program has been organized so that one knows what is what and what kind of benefits one can get. See, as lawyers, as judges, we always have the habit of talking about law only. You go to the market, you go at home, thinking that you'll discuss something else, and again you start talking about law only. So I have to begin with saying that the health and well-being of a person, of a citizen of the country, is provided by the Part 3 of the Constitution of India. Article 21 provides for that. Protection of life and personal liberty, which includes the right of elderly senior citizens and the right to dignity, the right to health, etc. It's a very important right, it's a fundamental right which is guaranteed by the Constitution of India. If there's any violation, you can enforce that in the court of law. And similarly, something like that, we have the directive principles of state policy, particularly in Article 47. It is the duty of the state to raise the level of nutrition and the standard of living and to improve the public health. Now, on this count, the state has a responsibility. Who is the state? State is nobody but you and me, the citizens. The elected government forms the state, they run the government. And I take this opportunity to congratulate the state government for coming up with this very good health scheme, starting from 2022, I believe. And it was there, something else was there earlier, but now this health scheme covers, it encompasses everyone. Government servants, the public, and even those people who don't fall neither of the camps. I should go there or I should go there. Thing is that you go to the nearest hospital to save your life. So this aspect of the matter has been covered, it seems, by this scheme. And I'm really happy to say that it's a very good beginning. Now, in a society, a robust healthcare system is the backbone of a thriving society. It directly drives the economic productivity, ensures population well-being, protects citizens from financial ruin due to medical emergencies. Now, it shifts the focus from just merely treating the illness, but to disease prevention and enhancing overall quality of life. It's very important. The other day, I spoke to one of my friend. He said he was away in Delhi for a long time. I said, for what reason? And he said, we had gone for medical treatment. He hails from the state of Nagaland, and he had taken his uncle. So he said he's covered by this scheme. Unfortunately, when they went to Gauhati, they did not find any proper hospital by which, it was empaneled. They went to Delhi. In Delhi, they got good results. 2 or 3 weeks of treatment, and I think that has really helped him. And the illness has been discovered, and the problem has been removed. So he was praising this healthcare scheme. So people are already using that, and today we are gathered here on the initiative of the High Court Bar Association and the Gauhati High Court Kohima Bench, jointly having organized this gathering. I congratulate them for this thought, and I wish all the members, all the participants today to have a very fruitful time. And I also extend my congratulations to the team who has come here to do the screening and all that. Whoever thinks that one should be screened should avail for that. It's a very good facility, very open-minded. And the doctor has spoken quite a lot about the scheme, and we're going to hear. I know you're not gathered here to hear me, so I'll end my speech here. Wish you all the very best on the seminar. Thank you.
Thank you, Lordship, for expounding the subject matter from the constitutional legal perspective and making us also understand on how fortunate we are to be part of this program that has been initiated for us. For now, we'll have a short tea break. I'm told that His Lordship is also about to go on a long journey. May we ask our caterers, our beautiful ladies, to please serve His Lordship's table first. After this, please take note that we have resource persons who will be guiding us on how we are to apply and get this benefit. And there will be an interactive session also, and spot registration as well. So please bear that in mind and ensure that we get this benefit and don't leave this place. Reserve your seats till the end of the program. Or while our ladies are preparing tea for us, may I ask some of our resource persons to kindly take over the stage and then apprise us and guide us on how this scheme is to be implemented. Our resource persons, are they here? I have made the announcement beforehand, so it appears our resource persons are making the preparations. They will take time only in their slot, not beforehand. Lordship and I'm told our media friends would like to take a picture now. So may I ask Brother Mujui and some of our senior members. Oh, Your Lordship would like to go down and sit there? Okay. Then in the first row, please. No, it's okay. We're not asking all of you to go, but ensure that no seat is left empty. Yes.
Cameraman can come here from me and take the picture with you.
আমি নাম Cmhis আছে আৰু আমি CM পেঞ্চিং কাৰ্ড চলাই আছে আমিলা মাকি আছে আৰু আমিলা বাচ্চা 6টা আছে মাকি 1টা আৰু মুতাটো 5টা আছে এইটো কাৰ্ডটো পেঞ্চিং কাৰ্ড লাগাটো মানুহখন বনাইছে কৈছে এইটো পৰা আমি বনাই লৈছে আমি বেমাৰটো কেঞ্চাৰ লা বেমাৰ আছে কৈছে এইটো পৰা নাগা হস্পিটেলতে ট্ৰিটমেণ্ট লৈ আছে
তো আসেনি হো আৰু মই আমাৰ বিমা হোৱাৰ কাৰণে তালা পালে তো আসেনি হো আৰু মই আমাৰ বিমা হোৱাৰ কাৰণে তালা পালে আৰু কথা কৰিলে আছে মুখান ইটো চিএম পেঞ্চনৰ কাৰণে ইটো চলাছে আৰু মুখান লা ফেমিলিতে আমাৰ বাবা আছে আৰু মুখান বাজা খানটো মুটা দুইটা মাইকী চাৰটা আছে দাদা লা অফিচ দেৱা ইটো কাৰ্ড বনাবি কোনে কাগজ আহিয়া কাৰণে মুখান ইটো বনাইছে মুখান লাষ্ট ইয়াৰ না হস্পিটেল আমালা ট্ৰিটমেণ্ট লোৱাটো তালা নাতে টিউমাৰ এটা ওলাইনে তালা সুকুত তে এফেক্ট হয়নে ইটো মুখান খেমো চলা আছে মুখান ইটো লা কাৰ্ড চলাব মুখান কে নেক্সট ট্ৰিটমেণ্ট ল'লে টাইম দিবি মুখান কে বিশে হেল্প কৰি দিয়ে ইটোতো মুখান ইটো কাৰ্ড আছে চলাটো কেতিয়া বেমাৰ হৈ নাথাকে মুখান কে বেছি হেল্প কৰি দিয়ে আৰু তুখামি কেতিয়া বেমাৰ হৈ থাকে নে পিছা নাথাকি থাকে টাইম দিবি ইটোতো মুখান কে বেছি হেল্প কৰি দিয়ে আছে ইটো কাৰণে কোন হ'লেবি নাবানাই নাথাকে খান ইটো বনাবি
Pekinto, Gairiliu and Nzibeni live in different districts of Nagaland. They have all had to seek medical treatment for different reasons, allowance scheme. These schemes covered only specific categories, government employees, pensioners and poor families. However, a sizable population of the households, the missing middle, was not covered. To improve access to healthcare for all citizens, the state government held consultations with various stakeholders. The World Bank was also roped in to provide technical support. On the 14th of October 2022, the Chief Minister Health Insurance Scheme, Cmhis, was launched in convergence with the National Health Insurance Scheme, ABPMJAY. For the first time in Nagaland, all indigenous inhabitants and permanent residents of the state were assured of free and cashless health insurance cover for any hospitalized treatment. The Chief Minister Health Insurance Scheme covers three categories: Cmhis General Category and ABPMJAY Category, covering up to Rs 5 lakh per family per year, and Cmhis Employees and Pensioners Category, covering up to Rs 20 lakh per family per year.
I stayed in the hospital for about 2 to 3 days. The medical expenses, I think it came around 57,000, which was taken care by this Cmhis.
আমি সি সেকশন কৰিছে নিকুতে থাইছে more than lakhs যাবলে আছে দে এদু কাৰ্ড থাকা নিমিতে তো আমি খান বেছি সেফ হৈছে কব
open surgery কৰিব লাগে কইকিনা আমি কে আৰু হায়াত হস্পিটাল গুৱাহাটীতে পাঠাইছে এটো বি এম্পানেলড হস্পিটাল থাকিছে এটো পৰা 3 weeks নিচিনা তাতে থাকিছে CMHIS লাগা কাৰ্ড লৈকিনা তাতে পৰা সব কভাৰ কৰি দিছে
While Cmhis eases the burden of healthcare spending for beneficiaries, hospitals empaneled under the scheme are also strengthened through the claims received and the increased volume of patients seeking treatment with the assurance of coverage provided by the scheme. House of Hope, a primary health center in Tuensang district, receives patients from all over eastern Nagaland. The health center uses the claim amount to provide nutritious meals to the patients, pay the support staff, and organize awareness programs. About 28,000 hospitals empaneled under ABPMJAY across India also covers the Cmhis General Category of beneficiaries. The state government is further working on getting more private hospitals across India, empaneled under Cmhis for employees and pensioners.
And I am happy to say that within the state, all the private hospitals and government hospitals are already empaneled. We have also created some helplines so that people who face any problems in the hospital, they get immediate response. We have even gone to the extent of providing them instant cards so that nobody is actually denied the benefit of availing this service.
By extending financial protection and access to quality health care, we are laying the foundation for a society where health disparities are minimized.
We're just getting started on our journey towards ensuring a healthier and more resilient Nagaland. The scheme is just not about insurance coverage or financial coverage for the beneficiaries. It's about fostering a culture of proactive health management.
Today, Nagaland is a step closer towards fulfilling the Nagaland Sustainable Development Goal Vision 2030. If all goes as planned, by 2030, Nagaland will ensure healthy lives and promote well-being for all ages by providing equitable, affordable, and quality healthcare services to the people of the state.
Bi panago lagi kuina Ayushman card panado ki free day China panai loise. Idu card panado amakan ke pishi support paise. Idu amakan poila idu na panadam dedo amakan pocket parai kharcha kuri thake. Holebi idu Ayushman card idu panabi chide idu tawa idu sob jati parai kini loise. Aji kun idu card na panai na thake ase panabole bishi important ase kile koile amakan bi poila do na jane holebi itu par khuni na China itu Ayushman card pana bichide ama bimar hoise tu card para makan ke bishi moto paise tawai laga poisa pura itu card parai panai loine itia iniga phal hoine thakya aside na panai na thakya manu nichor district hospital noilebi computer shop khande panai itu karni China kun pananai China panabide koine itu message chanai dia ase.
Amela nam bizo kosu ase. Ami pensioners office pra Cmhis la card paigine tadela bishi modot pai ase. Ami to pensioner ase bura manu hoise family member to 7 jon ase bacha 5ta ase aru ama baba ami to pensioner ase pension office te jai thake.
Of that procedure, I'd like to request the resource persons to take the stage for that. There are some officials led by our Dr. Kikamarn is here, but I believe there is someone to assist him, to apprise us of the procedure and how to apply to get the facility. Yes, Your Lordship, now we are interested in how to apply and get registered.